Hello, my name is Hani, and today I'll be going over the condition known as pseudohyponatremia. Many of our medical terms come from Latin or Greek. The following is the etymology of the word pseudohyponatremia. Pseudo means fake. Hypo means below, or in this case, insufficient. Natrium refers to sodium. And emia comes from hyma, which is Greek for blood. Overall, this term is used to define an anomaly sometimes observed when conducting lab testing for sodium levels in the bloodstream. We will dive into this later on. Firstly, what is normal hyponatremia? Hyponatremia is a condition in which there is an abnormally low amount of sodium in the bloodstream. In terms of numbers, this means less than 133 millimoles of sodium per liter of blood, or about 3.06 grams of sodium per liter of blood. Why is this dangerous? Sodium is crucial for many bodily functions, such as maintaining the body's fluid levels, controlling blood pressure, and helping with conducting nerve impulses. Low sodium levels can lead to confusion, abnormal behavior, and signs of nervous system irritability. Therefore, it is important to test for and assess for this condition when it is speculated in a patient. So now back to pseudohyponatremia. This anomaly occurs when testing suggests that the patient in question has abnormally low sodium in the bloodstream, but as mentioned before, pseudo means fake. Overall, pseudohyponatremia is a fake deficiency of sodium in the bloodstream, as in the patient actually has normal levels of sodium even though the test says otherwise. How do we know for sure that the patient has pseudohyponatremia and not actual hyponatremia? This is where we test for osmolality. Osmolality is a concentration of several chemical components in the fluid part of the blood. It is primarily determined by sodium concentration or the amount of sodium per amount of fluid in the blood. The normal range is considered about 275 to 295 millimoles per kilogram. Therefore, if someone has abnormally low sodium levels but normal osmolality, we can conclude that they have pseudohyponatremia and not hyponatremia. But if they have both low osmolality and sodium levels, then they do have hyponatremia. But how does this occur? There are two possible reasons why pseudohyponatremia happens. This can happen if the patient has hyperlipidemia, or high levels of lipids like cholesterol in the blood. This can also happen if the patient has hyperglycemia, or high levels of glucose in the blood. In the case of hyperlipidemia, higher amounts of cholesterol takes up space in the bloodstream, resulting in lower amounts of plasma or water content in the blood. This lower level of plasma results in pseudohyponatremia. In the case of hyperglycemia, the high amount of glucose in the blood draws out water from the cells of the body and into the bloodstream, diluting it. The more water in the bloodstream makes it seem like the ratio of sodium to fluid is low, when the actual sodium levels are normal, resulting in pseudohyponatremia. According to a study from 2014 by Mohan and colleagues, the prevalence of true hyponatremia is 1.72% in the United States of America. That's about 17 out of every 1,000 Americans. It is commonly found in people with high blood pressure, diabetes, coronary artery disease, stroke, and other conditions. It is imperative to correctly diagnose hyponatremia, as failure to do so can result in further complications and even death. Overall, the human body is quite complex, with many intricate organ systems all working in tandem to achieve such incredible tasks. One of the ways in which we can screen and study the body is through clinical biochemistry. However, as evident with pseudohyponatremia, the testing involving clinical biochemistry, such as blood testing, may not always clearly indicate whether or not our bodies are healthy or in peril condition. This is why, in the case of pseudohyponatremia, clinical biochemists must conduct more detailed lab testing, such as testing for lipids and glucose with sodium levels, when assessing the homeostasis or healthy equilibrium of the human body. Thanks for watching.